Good morning, and thank you for joining us for today's webinar, Health AI 101, Building Trustworthy AI for Better Healthcare Outcomes. Before we begin, I would like to go over a few housekeeping items. Today's webinar will be recorded and available through YouTube. A link will be sent out to the attendees after the webinar recording is posted. To minimize noise and distraction, all attendees' microphones have been muted. However, if you have a question or comment during the presentation, please submit it at any time using your Q&A box. We will do our best to address all questions and comments at the end. I will now turn the presentation over to our moderator, David Johnson. Thank you.
Thank you, everyone, for joining us. Good morning. I'm David Johnson, CEO of the MidAtlantic Business Group on Health, and I'd like to welcome you to the Health AI 101, Building Trustworthy AI for Better Healthcare Outcomes. The MidAtlantic Business Group on Health is a nonprofit, employer-led coalition working with employers, labor leaders, healthcare providers, policymakers, consultants, and other stakeholders to improve healthcare quality, access, and affordability in Virginia, Washington, D.C., Maryland, and throughout the country. Today's webinar is the first in a series of educational programs we will be doing with the Consumer Technology Association, North America's largest technology trade association. Recognizing that employers are the largest private funders of healthcare in the United States, we believe it is essential for employers to have a voice in the development, deployment, and financing of artificial intelligence in healthcare. We are optimistic about the potential for AI to improve healthcare quality, access, and affordability, while we also maintain a focus on ensuring AI is used safely and appropriately in healthcare. For today's webinar, we encourage you all to submit questions in the chat feature of Zoom, and we will do our best to cover each of those questions after the prepared presentation from our speakers. So I'm excited now to introduce our two distinguished speakers from the Consumer Technology Association. Renee Quashie is the first Vice President of Digital Health at CTA, where he provides guidance on key technical, legal, and regulatory issues relating to digital health technology, products, services, software, and apps. Carrie Harrisine is Senior Director in the Technology and Standards Department of CTA, where she is responsible for the oversight and management of CTA's domestic standards activities, including health and fitness, wellness technology, AI, their AI intelligence committee, video, audio, smart energy, and their associated working groups that develops standards, bulletins, and other technical publications. And with that, I am delighted to turn it over to my friends at CTA.
Great. Thank you very much. So Carrie is going to run the slides here. So Carrie, maybe you could move to the next slide. So before we get into the meat of the matter, I think it's important to sort of provide you a background of who we are as an organization. And also to tell you the great news about this program. We are not selling anything. We're not vendors. We don't have a product. There's going to be no hard sell. We just want to provide a little bit of our perspectives given the members we've worked with. So as David said, CTA is the largest trade association representing the technology sector in North America. And here on this slide, you see the incredible diversity and variety of our membership, right? So from the healthcare perspective, is folks like Abbott, right? Elevance Health is a member as well. But if you look at the whole sort of menu and roster of members, it spans the gamut. So for example, one of the ones I always point out when I'm doing these sort of talks is John Deere. You would think John Deere, old Midwestern company, right, as old school as it gets. But John Deere happens to be one of the most technologically sophisticated companies in the world. It turns out that John Deere is one of the largest manufacturers of automated machinery in the world. They're also very immersed in precision agriculture. They are a tech company that's masquerading as an old agricultural company. We also have folks that are usual suspects like Apple and Microsoft and others. But I think one of the interesting things about us is 80% of our members are medium and small sized businesses. Carrie, next. Before we get going, I wanted to also let everybody know that we are doing what we're calling CTA Health Week. It's our inaugural Health Week. As an association is September 8th through the 10th. We have a variety of programs, including a Health AI Plus conference, which is invitation only. But we would extend an invitation, a complimentary invitation to anybody on this webinar who would like to come. We have great speakers from the technology sector, clinician thought leaders. We also have government speakers as well. So September 8th through 10th, anybody who's interested in finding out more can reach out to us. Harry, next. So one of the things we really focused on, particularly Carrie and I, is on health AI. And this has been an incredibly complex topic that we got into about 3 or 4 years ago. We have a whole page dedicated to a number of thoughts and ideas, articles and comments we've had on health AI, but we're really sort of involved in the health AI space. Number one, Carrie runs a health AI planning council, really looking at the future of health and where standards may be able to play a role in bringing to market safe and effective AI solutions in healthcare. I run a Health AI collaborative, which is a collaborative of all the major trade associations that have some significant voice in health AI that includes folks like the American Hospital Association, the American Heart Association, AHIP, and others. We have done research on health AI, which we're going to talk a little bit about in a moment, but we're really sort of really ensconced in this. In fact, this past Friday, Carrie and I sat at an all-day meeting where we brought together some of the largest generative AI companies like Anthropic and Microsoft and others to sit down and figure out what are the best ways to regulate some of these solutions. So we're really heavily involved at the sort of association level about shaping the future of health AI. Next.
Right. So I think Renee, I'll jump in here quick. So before we dive into a little bit more details about Health AI and the work we've been doing, we thought it would be really great to kind of level set with all of you. And so throughout the session today, we're going to have a series of polls using Slido. It should be pretty straightforward. You could scan the QR code on the screen. You could also go to slido.com. And enter the code there. But we wanted to kind of hear from all of you to start. Are you actually using AI today? And while folks are queuing up their answers, and it's great, and we'll be able to see them here in real time on the slide, is that I know personally, as we've been trying to use it more in our professional life, I've also been trying to use it a little bit more in my personal life, helping me identify some recipes and, food planning. It makes a grocery list for you. It gives you different ideas that you might not have thought about. And I think that that's kind of a really interesting way to begin to extrapolate it into our professional lives as well. And so, Renee, I know you've been dabbling with it a little bit, both professionally and personally, as well. And it looks like folks are using it. I'm glad to see, at least so far, I think by opting in to be here, you're probably interested. So it doesn't look like anybody said no, they're not interested yet. But I think this is just a really, really interested. Oh, we had one no, not interested there. Okay, that's interesting.
I would I would venture to guess, Carrie, that I think the yeses, most of whom are using some kind of LLM program that's commercially available, whether it's ChatGPT, Claude, Gemini, Copilot, whatever your LLM product of choice is. And I think it's interesting because when ChatGPT debuted in November 2022, really didn't start getting used till the spring of 2023. We were told that this is just, it's sort of a Google on steroids, a search engine that is maximizing sort of outputs, right? But now, if you look back just a little over 3.5 years later, think about the way it's changed the way we work, the way we think, the way we write, the way we plan our vacations. It's been an incredibly interesting progression in just a very short time. And therein lies some of the challenges and opportunities with AI. So why does health AI matter now? A quick story. I was talking to a physician, a clinical leader at Northwestern, and I said to her that I was listening to a podcast, and the podcaster said that the AI world can be divided into two. AI doomsayers and AI optimists. So I asked her, which one are you? She took a beat and looked at me and says, I am AI inevitable. And I thought that was a great answer because whether we like it or not, no matter what we think, it's coming. It's here in many ways. It's going to continue to dominate a lot of how we do things, particularly in the AI community. So listen, this is here. We need to figure out the best way to safeguard, put guardrails on it to make sure we're using this very safely and very effectively. And I think the employer community has a huge role to play, as David mentioned in his opening. Your sector is the largest purchaser in the private markets of healthcare services, and you have a very influential role to play regarding not just health AI, but digital and emerging health tech tools generally. Next. So I mentioned that part of what we do is research, and last year we did both a qualitative and quantitative study where we tried to talk to health practitioners about how they feel about AI, how they're using it, what some of the challenges and concerns are with AI. And one of the things we were kind of surprised at was ultimately a lot of clinicians are very, very optimistic about the ability of AI eventually, right, to really impact health outcomes in a positive way. But there were a ton of concerns, some of which are listed here, privacy. But the one I hear a lot about is the accuracy of these tools. Are these tools' outputs accurate enough for clinicians to rely on, particularly in clinical care? And because of some of those questions, what you're seeing is AI is being deployed in the healthcare system for administrative and operational reasons now. We can all talk about things for billing, revenue cycle management, and the rest of it. But what I'm here to say is that I think that's going to change rapidly in the next half decade. And I think more and more AI tools are going to be used directly in clinical care. The other thing that came out of this research report, which I thought was very interesting, when a lot of clinicians express concerns that they're going to be so reliant on AI tools that their ability to think critically about the issues in front of them, particularly from the clinical perspective, is going to be heavily impacted. This sort of over-reliance on AI. We see it in other areas as well, right? We think about, is writing going to change? Are we going to be able to be as creative as we were before? Are there going to be cognitive declines because of the use of AI? And we see that clinicians also have the same concerns when it comes to the professional use of these tools. Next.
Oops, there we go. Yeah, and that was my favorite, most interesting, I think, finding out of that study. But I think it also causes us to take a little bit of a step back and kind of what do we actually mean by AI? It's here. We all know that. It's here in our personal lives, it's here in our professional lives. But I think one of the things that we really talk a lot about is that it's important to begin to understand what do we mean by that. And we look at the role of the employer or the role of the clinician. And you all do not need to be an expert in the technical part of AI. I'm not. I think Renee would agree he's not. We probably know a little too much to be dangerous when we gather with our member companies about it. But I think what is really important is beginning to kind of ground yourself and understanding what kind of AI, what is it intended to do? What types of data does it rely on? And what is the role of the human in the conversation? Because as these models get more and more sophisticated, there's the word there, we're really going to be kind of understanding against benchmarks. And we know today that AI is able to do things that we're not able to do. So as humans, so it's going to be really interesting to see how we kind of grade and rate these benchmarks. We have a few kind of terminology on here on the screen. I think it's some of the kind of common ones that you'll hear. Traditional AI, closed loop. This is going to be something that predicts or classifies. I always kind of like to say this is something that isn't learning in real time, something that's going to be kind of contained, intentionally contained from start to finish. Generative AI is really a lot of what we talk about when people kind of you pass somebody on the street and they say, what is AI? They're probably talking about generative AI. As Renee said, that entire rhetoric changed in 2022 when we all started to get exposed to Chat GPT. But generative AI itself is going to have new content. It's going to synthesize information. It's learning and interacting throughout the process. And then there's lots of different terms that begin to exist around it. Multimodal AI, agentic AI is one we're starting to hear a lot of, and I'm guessing is also beginning to really pop up in the employer space. And so at CTA, we've tried to take a stab at some definitions. I'm the first to say I don't know that they're the best. They're definitely not the only. It's very hard to, as you have this type of technology that's growing and evolving in real time, figuring out exactly what the definition is. But I think one of the lessons we learned and want to bring towards this community is that really a lot of it is just about understanding what it's intended to do, what the data sources are, and then what role the human is going to play inside the process. And we'll talk a little bit more about ways to do that along the way. And so with that, I want to kind of bring up another poll here to kind of ask all of you, this is just going to be kind of a word cloud. So, where are you seeing AI used in healthcare today? I think one of the ones we know we're seeing out there is folks are going to LLMs maybe prior to going to the ER or places like that to kind of validate some of their symptoms. Not surprised to see prior authorizations, Renee, pop up here first for this audience. Note taking is definitely one. Transcripting. I think the note taking one is probably one of the earlier ones we started to see where we saw kind of digital assistants pop up in the room, health coaching. It's really interesting to see kind of the mix probably of folks both professionally and personally and their interactions with the healthcare system. Education is an interesting one. Audits, still see some folks typing.
Yeah, what's interesting about this is sort of what I said earlier, in that what we're seeing a lot of in healthcare today when it comes to the use of AI is what I would call operational administrative sort of task, right? There's very little here that's clinical or directly clinical. And I think that's very interesting. And I think part of that is a trust issue. Part of that is I think the AI community is now starting to really build and introduce in the market products that impact clinical care. But again, if you look at a lot of this here, we're talking about, for the most part, a lot of operational administrative uses of AI.
Yeah, and starting to see that slight movement when we look at interpreting test results.
Yeah, yeah.
So I'm gonna get back to the slides here real quick, and apologies, I'm jockeying between a few windows. And again, I think this is a lot of what we just saw there, Renee, operations, but some of the stuff maybe that's coming, like clinical care, document summaries.
Yeah, and look, and I think the uses of AI in clinical care are starting to show themselves, right? So you think about medical imaging analysis, right? The ability of AI to flag emergent finding on scans, reprioritize how the radiologist is viewing the images that are in front of them. Sepsis and early warning systems, we've seen this. There's been some controversies about the algorithms that have been used to monitor vitals and labs to sort of identify patients who are at risk of sepsis. We have AI triage that is being used in emergency departments today that help rank incoming patients by acuity. So the sickest or those suffering the most trauma get the care the most. We see some in clinical decision support. These are tools that have been actually used for the last decade that surface, relevant guidelines, drug interactions, different diagnoses at the point of care. Readmission risk prediction. This is used quite a bit, actually. There are models that score discharge-ready patients, the likelihood of some of the patients to return. And then in the consumer-facing space, there's a lot of AI being used in the wearable and remote patient monitoring space that synthesize data for patients. And some provide early warning signs for diabetes and heart failure and COPD and other things. So I think the diversity of AI use cases is growing by the minute.
Yeah, I think wearables and AI could be a whole nother webinar that we might do as we look to the future for sure. Well, let's kind of ask you all to look a little bit into the future then. And, if we look forward to 2030, Where might you all start to think you might see some of this AI used in healthcare? And it could be through your professional lens or your personal lens. I think that intersection of real-time health data is really interesting, as we're seeing more and more folks wear wearables. The triage is interesting. I think a lot of that even came out of the COVID times where there was trying to figure out ways to get people into the right place at the right times. We're seeing behavioral health supports, care navigation. Yeah, I think that's definitely a big one that we expect. Behavioral health is interesting. I think we know there's a lot of opportunities and probably a lot of challenges there as well, for behavioral health, but we know people are using AI that way today, which is really interesting. Primary
Yeah.
care access. No, go ahead, Renee.
No, these are interesting. I think one of the things I would throw in here, and I know we don't want to talk about this, and this is one of the reasons why I think a lot of clinicians have sort of this love-hate relationship with AI. I think what we're going to see within the next 5 years is, I think, the building of some kind of virtual clinician, that is going to be subject to oversight by the human clinician. But I think you're going to start to see AI being used to do a lot of things traditionally done by physicians or nurses. And you already have virtual nursing assistants in the market. And I think that is going to accelerate at pace. And I think it's going to raise a number of issues and a number of questions about practice of medicine. There's going to be this dichotomy between clinician and machine. And so I think you're going to see quite more of that than I think is being reflected here in the poll results.
Yeah, and Renee, you mentioned Health Week at the start of the presentation, and CTA, a little teaser, will actually be releasing a study that week, looking at consumers' interactions with AI and social media regarding healthcare. And having had a preview to that recently, there's some really interesting nuggets in there. I think the way just we all are using AI today, so stay tuned for that for sure. I think this one interesting one before we move on, allowing clinicians to spend more time with patients. And I think that that's the hope, but I know we're going to talk a little bit about clinician concerns here in a few slides, but I think there's also a concern that having more freeing up time makes them just need to see more patients. So there's an interesting balance there, I think, that we need to tease out for sure. Okay, I'm going to jump back to my slides here real quickly. And I just wanted to highlight that CTA has been starting to build kind of a resource of member stories about how AI is helping everybody in everyday life today. And encourage you to take a look at this on our website. And while there are a few great healthcare examples there, I think one of the things that's also really interesting is learning from other sectors that are embracing AI when we look at healthcare and AI. And not on the screen here, but a really great example is you might think about things like self-driving, where we're seeing kind of risk levels be implemented and, AI being used in such a critical way. And so this might just be of interest to all of you. I encourage you to check it out. It has kind of some very simple examples of how AI is out there. And I think it's always interesting to also look at ways where people might not realize that there is AI happening behind the scenes. Your Netflix recommendation is probably most people's number one interaction with AI.
Actually, I would probably say their GPS of choice, right? Your Waze,
That's
Google,
true.
yeah.
All right, so now we've talked a little bit about kind of what AI is, why we're talking about it, and for full transparency, when I was working, Renee and I were working on creating the slides, I asked one of my AI tools to create a sentence for me about this section of the presentation, and it could not have been more perfect. So I wanted to include it here and talk a little bit about trust. Not just being a slogan, but an operational requirement. I mean, we're talking about our health, we're talking about the trust that exists out there, and there's a lot that we need to do to ensure that's done correctly. And so we wanted to kind of start again, and I'll pull up my second round of polls here and hear from all of you. What are some of your biggest concerns? Again, whether it's through your professional life or personal life, about AI in healthcare today. I'm sure folks are starting to type here. I think we might expect privacy to pop up here. I think, Renee, that's one of the main ones we hear across the board.
Absolutely.
Accuracy, yeah, what is it actually doing? Bias is a big one. I think we'll touch on that a little bit. That could probably be a whole nother webinar on the series. But I think a lot of people they want to embrace, but do also have some of these concerns that are out there.
And Carrie, I don't know if others are having the same challenge, but mine is not advancing on the app on my phone. So it's stuck on the last question.
So you might need to redo the link on this one, David. It's in a slightly different instance. So you might need to rescan the QR code. That might work for this one.
Others may need to do the same thing then. Okay, good.
Thanks for flagging that. Technology. If only it all worked in a standardized way. We see a few folks typing on there. Upcoding to maximize privacy. Accuracy. I like how it makes it bigger when we have more than one folks type in the same concern here. I want human in the loop. It's definitely a lot of folks are interested in that profiteering. Okay, well, interesting stuff here. I'm gonna jockey back to our slides and I think again reflected in the slide here, but these are some of the main highlights that we're hearing. And I think accuracy is very much tied to reliability. What are the concerns if the AI hallucinates or does something wrong? Data quality, bias, and representativeness. Like we know that technology can help us address and reach populations, understand things that we might not have known before. But if the data is not great, how does that, reflect longer term? Privacy, security, compliance, huge issue across the board, across healthcare at large that we're seeing that I think is maybe only being amplified by some of these AI conversations. Transparency and explainability, I think again, and liability and accountability, a lot of that ties to that human in the loop question and beginning to kind of understand what role does the human have to play versus the technology. So these are definitely kind of big issues that we're seeing. And David, I'm going to kind of cue you in here and get your thoughts on these kind of hypotheses about maybe some of the trust questions that exist from the employer perspective. Kind of noting employers may subsidize, purchase, or influence the digital health tools and AI-enabled benefits, but the question exists around evidence. And engagement, safety, efficacy, clinical validation, outcomes, and effectiveness. And then, again, that kind of transparency. So I'd love to maybe get your reactions here on some of our hypotheses. Wow, big words this morning, about the employer perspective.
Well, thank you, Carrie. And I think it is tough for employers and those supporting employers to really be able to track AI with so many things happening in AI and healthcare. And so I appreciate that question. And I think it's tough for employers to know where to turn for really reliable information to know that just like you aren't selling things to us this morning, you're bringing information. I think that's one of the challenges for employers and those supporting employers. Where do we go to for meaningful, unbiased information on what really is working in health AI, and how do we enable these developments and improvements in quality, access, and affordability, in a way that doesn't jeopardize what is working about healthcare. So where do we go for more information is a key thing. And I think also how do we make sure that appropriate research is being done on the return on investment, and on, are we protecting privacy? So that research part is really, really important. Who's keeping an eye on things from a research standpoint, and to make sure it really does work? It really is evidence-based. And so those are just two things that I would mention but I think it is so important. And this is why we emphasize the importance of doing these programs with CTA and MidAtlantic Business Group on Health, employers need to have a voice. They need to have a voice in the development, deployment, and the financing of AI. So how do we make sure employers continue to have a voice and that things are not just happening in the development and then sort of end products being brought to employers, but we want to make sure employers have a voice in the early development, the deployment, as well as the financing. I threw a lot at you, Carrie, there, but your question. And I would encourage employers to submit their thoughts in the Q&A as well. In the chat.
Yeah, absolutely. I think, go ahead, Renee.
I was just going to say, Carrie, didn't you have a standard that you published about a year ago about some of the questions purchasers of these solutions needs to be asking? I wonder if that could be translated into what employers should be asking when sort of thinking through AI solutions.
It's on the to-do list. We haven't published it yet.
Got it.
But seems like maybe a good opportunity and project to work together on. And yeah, I agree. I would love to get folks' thoughts in the Q&A as well. And Renee, I'll maybe hand it over to you for the next slide. We're talking about employers as well, but I think we know the clinician is a huge part of this circle when we think about healthcare deployment. And there's mixed feelings out there amongst clinicians about the trust of AI today.
Yeah, I think mixed feelings is an accurate term. I think ultimately, I think generally people see the potential for AI to be a game changer, but I think there are a lot of issues underlying. And I think we could boil it down into certain questions, and I wrote some down. For example, can I trust what the AI is telling me? I can't tell you the number of clinician and clinician groups. I've been doing a lot of speaking and talking over the last 6 months in front of clinician groups, and I can't tell you the number of times people say, I just don't trust what the AI is telling me, right? Which goes to the second point, how did the AI arrive at its particular answers, outputs, or solutions? And I think there's a lot of mistrust about the processes, the data training sets, and all of that. The other one I hear a lot is, what happens if the AI goes wrong? Who is responsible? Developer, deployer, end user. There's a lot of that is occurring out there. I mentioned this earlier about over-reliance. So another question I always get is, am I still going to be able to use my training, my expertise, my experience the way I want if I'm increasingly relying on AI solutions as part of the care that I'm providing? Related to that, is the AI advising me, or is it eventually going to be directing me? So I'm basically just a cog in the wheel, and I'm going to do what the AI tells me to do. And then the other question related to that is, if a clinician does not take the advice of the particular AI solution, again, this is all clinical care related. Who's responsible? Am I going to be responsible? Where does human judgment fit into all those? So those are some of the issues that I've been hearing a lot. The other one here is, I guess, sort of embedded in the workforce issue, which is, am I going to be replaced? Is this a eventual way to replace clinicians, to replace the human in the loop, the human on the loop? And there's a lot of fear that as these things become more and more sophisticated, that a lot of care is going to be automated and not had human oversight. So that's some of what I hear. And so I think as these tools become more embedded in our healthcare system, I think clinicians are getting more and more nervous about where this is actually going to lead.
Yeah, and we saw that earlier, folks' response of clinicians being able to maybe spend more time with patients, and what does that look like from a workforce perspective as well. And so kind of moving us along, I think one of the ways at CTA that we firmly believe helps build trust is industry standards and industry best practices. And so, and that's what I spend my day job doing, which is really exciting. And at CTA, we've been doing industry standards on AI actually since 2019. I kind of like to joke before it was cool, before other folks were really embedded and ingrained in this. And it's because we really saw saw both the opportunity and the need. We know that for this technology to meet all of the expectations and really improve lives, which it absolutely can do, we need to make sure we have some industry best practices in place. And so today we have 5 dedicated health AI standards. You'll see a few of them on the screen here. Shared one regarding the definitions document earlier in the presentation, with a 6th standard imminent coming in conjunction, hopefully, with our Health Week later this fall. And really, what we're focused on through the lens of standardization is setting these industry benchmarks that make and establish that trust, but also allow for the growth and innovation on top of it. This field is moving so rapidly, and we want to maximize it. And so, what is the balance of the necessary guardrails, but also the flexibility for innovation? Standards is an open process. So if any of you are interested in helping to engage and support the standards work, we would absolutely welcome that. We can share information about that offline. But we really do see this as kind of an important tool in order to help support the industry. And then also, and as I pivot here to the next slide and pass it back to Renee, support and address some of the maybe regulatory challenges and things that we're seeing as well.
Yeah, this is where I spent a lot of my time, and so we'll take the top and bottom one first. I think, listen, there's no question about it that the states have been incredibly active in sort of passing AI legislation, considering AI legislation, particularly when it comes to chatbots and some other issues as well within AI. And that's because the federal government has really largely been absent on these debates, right? We've had a few executive orders from the president. We've had some agencies release some guidance and RFIs, and there have been some initiatives. But in terms of really sort of owning the space, the feds have really been missing. And so what you have now is you have a series of sometimes contradictory, sometimes complementary state laws that are being passed. And most state legislative sessions have finished for the year. They're going to start in January, and we can expect a slew. We're talking about thousands of pieces of legislation introduced in 50 states. Why this is very complicating, why this is a complicating factor for employers is there are going to be differing standards on what you can and can't do. Some states are going to ban chatbots, others are going to allow chatbots, just as an example. And I don't see that being simplified in any way. Now, depending on what happens in the midterm elections, I think you could see Congress potentially act next year. But as we know, Congress is slow, it's become very dysfunctional and very partisan. So I expect the states to continue to play a leading role here. The other thing we've talked about consistently, in fact, we have a brief on our Health AI page, is lack of consistent reimbursement pathways, both in federal programs, Medicare and Medicaid, and commercial insurers. Insurance entities are having trouble determining how to best cover and reimburse these solutions. They're very varied, they're very diverse. And I think this is going to become much more critical as much more AI becomes really embedded in direct clinical care as opposed to operational and administrative functions. And then prior authorization, I'm no expert on this, but everybody knows that there's been a huge issue on the use of AI on both sides, insurer and clinician patient, on prior authorization issues. It continues. And I don't see that going away anytime soon. So those are some of the issues that I deal with on a level. But again, I think the biggest point here is the states are incredibly active, incredibly interested, are legislating and regulating. And what that's going to create is a patchwork. And it's going to be very complicated if you're running regional or national programs to have a one-size-fits-all approach to AI.
Yeah, and Renee, we do have a few slides here on the brief, and again, I think it's linked here in the slides, just about the reimbursement area. I don't know if you want to dive in a little further here.
Yeah, and I think one of the brief really focuses on the Medicare piece of it and walks you through how how services are reimbursed under Medicare, Part A, B, and C, and why AI coverage and reimbursement for AI is going to be incredibly problematic. given the existing way in which we pay for healthcare today. And we don't need to go into all of this, but here is sort of a few points that we made in the brief itself. And one of the things we didn't mention in the brief, I think there's been a lot of talk about creating a Medicare Part E for emerging technology, really looking at different ways in which the Medicare program can cover and reimburse for these technologies in an innovative way that's not tied to the way we've done it in traditional fee-for-service. So just a little bit of color to that, but I would encourage people to read the brief. It really goes into detail on some of the issues and opportunities that exist for Medicare coverage of AI tools.
Yeah, absolutely. And we'll queue up. We'll have one more question, feedback from all of you before we hand it back to David and open up questions. But I think these are some of the kind of things that we're seeing overall, and hopefully were reflected in our presentation today about how do we get from the hype to the better outcomes. And so, we know that AI alone isn't going to improve healthcare. Trusts and implementation will. We have to get these AI technologies in the hands of practitioners that are using them, and we need to speed to market in order to do that. We know that adoption needs to be guided by evidence, risk, accountability, all of the concerns that we all raised here. And that employers are going to play a really critical role in purchasing benefit sponsors and advocates for the use of AI. And seeing in the chat kind of some of the frontline engagement as well that folks are talking about, and getting that direct input from employees, asking them to help and use AI to do so. Trustworthy AI is critical. It's going to require transparency, privacy, validation, human oversight. Again, what that looks like on the loop, in the loop. There's a new term for that. I think every day. I know Renee mentioned we were in a meeting on Friday. We learned some new terms for that just a few days ago. But we know that we need to make sure we have these right benchmarks and guardrails in place. And then standards and policy frameworks can accelerate responsible innovation, but they also, need to be in place in order to do so. And so one last poll from all of you, if I can get my mouse up here, is we really kind of want to hear from all of you, through your lens as an employer, what role do you all see yourselves playing in scaling of AI in healthcare? And maybe that will help inform some of our future conversations in a webinar series. But really curious, having heard all of this, what all of you think your role might be. I think my role as a standards professional is to just make sure folks aren't afraid of it and really find a good way to embrace this and use it in their everyday lives so that they're comfortable using it in their professional lives. So pushing vendors to use AI effectively. That's great. Protecting confidentiality, really important. I know we see higher concerns when we talk about certain aspects of our health and use of AI, like mental health, reproductive health. Concerns definitely raise in those areas. Confidentiality is huge.
Yeah, and I think to add to that, I think there's a misunderstanding of HIPAA and how it applies. And the threshold question under HIPAA is whether or not you're a covered entity or a business associate. If you are, then HIPAA applies to you. If you're not, HIPAA does not apply to you. So for example, in the wearable space, I think there's a misunderstanding that a lot of wearable data is covered under HIPAA, and it's not, because wearable companies are not covered entities or business associates under HIPAA. So one of the things that CTA has long advocated for is a comprehensive federal privacy framework that covers all manner of data, particularly data, for example, that's not covered under HIPAA. So that's something that the United States lags on. All industrialized countries have comprehensive federal privacy legislation that would address some of these concerns around privacy and confidentiality.
Yeah. I think another interesting one here is prioritizing how AI is used, like not thinking that AI can solve every problem and thinking about ways to use it effectively. I think is really a powerful and an interesting piece of this for sure.
Yeah, and I see transparency, and I think that's a big one. And again, that goes back to some of the questions I posed that sort of summarize a lot of the concerns I'm hearing from the clinician community. How does the AI solution get to its output and its advice at the end of it? And I think there's a lot of confusion about that. and quite frankly, a lot of mistrust about that, right? We don't see it.
All right. Well, David, that's the end of our talk here, and would love to hand it over to you. And I think both Renee and I are happy to answer any questions or hear any feedback or thoughts from the attendees as well, on areas they'd love to learn more from.
Well, Carrie and Renee, thank you so much for the very insightful comments, balanced comments, and approaching so many different important areas of health AI. We've got some great questions come in, and I want to begin to share those with you. You may have seen the questions in the chat as well, but I want to start with a question about how do we ensure we have the appropriate offsets for upcoding and billing by providers and facilities. So as healthcare providers are finding ways to leverage AI to maximize their reimbursement through things like upcoding, how do we help balance that with what the health plans, with what employers are doing to help drive more efficiency? So how do we balance those? Providers finding creative ways to make more money, and many could argue, well, they should make more money in appropriate ways. But how do we balance like providers using AI to make more money with the need for employers to drive efficiencies? And we don't want this to be just another source of healthcare inflation. There's enough pressure on health inflation today. How do we make sure we're driving cost downward appropriately by improving outcomes and access?
Yeah, I'll take a shot at that. I think this administration, for whatever one thinks about this administration, has been laser focused on fraud issues, particularly at the CMS level. They've got all kinds of interesting anti-fraud programs they've introduced. And one of the ways in which they're going to be combating fraud, and I don't mean to be cute here, is through the use of technology, right? So AI really being leveraged to really sort of identify trends in particular areas. And so I think the technology is going to play a large part in policing the misuse of technology, believe it or not.
Thank you, Renee. Any thoughts on how employers, and this also came in on the Q&A, how can employers better explain and educate their workforce on AI as a benefit? I mean, there's so much misinformation that's out about AI, in particular AI in healthcare. So what role can employers play, and where can they go for the right information to share with employees about how AI can be helpful in improving health outcomes?
Gary?
Yeah, I think one of the ways to start is thinking again about that personal use example, and getting a level of comfort with using the technology in small and maybe lower risk ways is a really, big step forward to combating some of the concern and risk. Unfortunately, a lot of the average people's perception on AI is some sort of movie where a robot takes over the world because it gets smarter than all of us. And I'm here to tell you that is not the reality of the world we live in, at least not today. I'm not a futurist, so I can't say that that will never come. But I think just kind of bringing it down again to some of those smaller applications that really folks begin to get comfortable with and engage with, whether it's planning your vacation or, as I mentioned, I'm using it for meal planning. And then you start to be able to kind of grow that confidence of how to use it when you have a guardrail or a concern. And I think that that goes a big way to extrapolating it into the workforce in a deeper sense. I don't know, Renee.
Yeah, and I think the other thing is these kinds of conversations we're having here, I think we need to have on a more regular basis. I will tell you that a lot of the responsible AI companies are quite disturbed by a lot of this disinformation, the hype around the technologies that are being developed. They would like nothing more than to dispel those myths and sit down with employers and others and say, these are our tools. This is what they do. This is what they can't do. Here are the concerns we have with the use of some of our tools. Here are some of the opportunities. But I think it's got to be some kind of continuing forum where we can talk to each other so we learn from each other's sectors.
There's also an excellent question about, it begins with a point that employees want their employers to have answers quickly. So as an example, the employee might come to their employer and ask, what can you do to provide a list of orthopedic providers within 10 minutes of my home that are highly skilled with good outcomes in knee replacement? So I think building on that observation, what role can employers play? If you think about consumers can and employees can get information directly using AI, what role can employers have in stepping in to make sure employees are getting reliable information? Is it on the one hand, let's just turn everyone loose on finding information on their own? To what degree is there a role for employers to be an additional resource for employees to help them find good information on healthcare and how to use AI appropriately?
Oh, what a tough question. I think, quite frankly, I think the employers ought to be working directly, and I'm just going to really limit my answer within the context of LLMs. I think employers should be working directly with the LLM companies to talk through some guardrails, how the information is provided, where they're getting the information, what kind of information they would like to see, because those companies are very open to listening to stakeholders like employers. We were just in a meeting on Friday, and these kinds of issues came up, and they're really looking for sector guidance, sector by sector guidance on the use of their tools. So I think employers talking directly to LLM companies, I think is a great first step.
So Renee, I agree with you 100%, and I want to build on that. How do we do that? And we think about collaboration, and I think about the role that an employer-led coalition like the MidAtlantic Business Group on Health has. How do we help facilitate those questions? Because I think for many of our participants on the call today, they may not necessarily know who to contact. Like, they're not going to know who to get in touch with in the tech world. Perhaps, maybe they do, maybe they don't. But, what role can we as a coalition play in helping facilitate that opportunity for employers to have their voice heard? And
well, at meetings like this and organizations like ours, so we have all the major LLM companies as members except one, but we're very friendly with them, and they were at the meeting we had on Friday. So I think coming to us and saying, hey, these are our concerns, these are our issues. Can we put together a group or a roundtable of tech companies, LLM companies, AI companies, and you guys can list the kind of companies you want, and then we bring you guys together as part of some sort of roundtable. And I think then we can sort of decide, okay, how do we continue to build this relationship? Is there some kind of forum we can build where we can pose questions and talk to each other? I think that's the first thing. But I think the first step is getting folks in the same room together to answer very directed questions. I don't know, Carrie, if you have any other thoughts on that.
Well, I think that it's important to know, as you said, that folks really want that. The LLM like they want this technology to be used. They want it to be used responsibly. But they understand that they can't just do that in a silo.
Exactly.
They definitely understand the response. With great power comes great responsibility when it comes to this. And so, I think a lot of times the perception might be that they're not as open to this, and we've definitely seen the opposite and heard the opposite from a lot of these folks.
great point. So, well, certainly speaking on behalf of the MidAtlantic Business Group and coalitions like us around the country, we do want to play a pivotal role in making sure the employer is part of these discussions. And I love your idea, Renee, of doing a roundtable where we get a good representation of employers to join in the room with tech companies, with developers of AI, to be able to talk these issues through, and how do we make sure that AI is used in the appropriate way to drive improvements in quality, access, and affordability. I do want to acknowledge an excellent question that came in about could you comment in the time that we have? We're getting a little short on time, but if you could comment on how we use AI to drive more effective population health programs. Because, thinking about all the ways that AI can integrate information from across the spectrum on what we know about a patient's experience in the healthcare system, their lifestyle, all those things. How do we use that AI to improve the effectiveness of population health programs for things like diabetes, as an example?
Yeah, I think that's a great question. I think part of this is information silos, people, stakeholders being unwilling to share some of the information that they have, right? I think in order for the population health management programs to work effectively, stakeholders have to come to the table and be willing to share some information. And so far, we haven't seen a ton of that. So I think that's the first thing. So AI is only as good as the inputs it receives. And so I think that's part of it. But I think what's very interesting and what's happening is I think unintentionally and not by design, I think we're creating an alternate health system. We have the traditional healthcare system. We all know clinicians, hospitals, health systems, your physician's office. But with all these other tools, wearables, some of your ambient sensor data, we are creating this parallel system that's creating volumes of data, right? Some of it healthcare related, some of it, as the question alludes to, having nothing to do specifically with health, but having to do with lifestyle and other things. And so we're creating this other lane that has tremendous amounts of data. But unfortunately, the two systems are parallel, so there's no bridge between the two. Right. And I think if we're able to build that, I think there would be tremendous uses in sort of the unified data for population health reasons for research. Think about all the incredible data that's being developed that's not being used in research circles and so on and so forth. So I think it's a great question, but I think there are too many silos. There are too many people who have proprietary information they're not willing to share, et cetera, et cetera, et cetera.
So breaking down those silos.
You got to break down the silo. Again, AI is only as good as the inputs it receives and it's trained on.
Absolutely. I know someone has put an excellent question into the chat dealing with the fact that employers are a powerful source of funding for innovation. And I think if we combine that with the fact that the employers have a role in making sure AI is used appropriately, and they bring the funds to put into development and deployment of AI, how do we make sure that employers have the ability to make choices based on evidence and understanding what the outcomes can be? The reality is everybody's selling something to employers. There's just an explosion of point solutions and tech companies that are now, putting things out in the marketplace. How do employers ensure they're making responsible decisions in terms of selecting the right AI tools to promote to their employees? So how can employers be better at determining which tools they want to promote with employers?
Gary, do you want to tackle it?
I mean, my answer is going to be compliance with industry standards, hands down. But I think the reality is it's a real challenge right now. We don't have an infrastructure today where there are a ton of benchmarks that are out there, and so I think that this is actually something that the industry. And again, at CTA, we are working on. We need to kind of help establish what the benchmarks are in a transparent way that folks like employers, when they're going through the procurement process, can understand not just solution X met their own internal, validation, but meeting that industry level validation. Some of that will probably happen through interaction with regulators, but as Renee alluded to, the federal system has not caught up here to the speed of innovation, and so there are improvements, I think, that need to be made there because that is a trusted source. Looking at industry standards. And I think, again, just having some of these conversations, most of the companies that we have the opportunity to interact with want to do this right. And I think would encourage and welcome questions from somebody prior to procuring. Talk to me about your benchmarks, explain what the validation and testing, where did the data sources come from? These are questions I think they're prepared to answer because they understand how impactful they are on the ultimate use of the solution. But Renee, I don't have anything you want to add on there.
No, I think that's exactly right. To underscore, there's no comprehensive evaluation framework, unfortunately, that employers and other stakeholders can use. I think it will be built eventually, but it just doesn't exist at the moment. And by the way, I think employers need to be at the table when these frameworks are being built, right? Because you have a unique perspective. And what I find is a lot of times we're having these conversations, the employer voice is not in the room. And a lot of it is the fault of other stakeholders. But I think the employers need to be at the table when all these sort of questions and issues are being discussed.
And that, my friend, is why we're here. I think that's I have to seize on that point, Renee, because you're absolutely right. And I think that underscores the pivotal role that we and other regional coalitions have around the country to make sure the employer's voice is heard in these discussions. And I know we're getting short on time, but I also want to mention, I think you touched on this earlier, Renee, the importance of what happens on the regulatory front. And I think, state and federal regulators have an opportunity to boost the effectiveness of AI, and they also have the ability to stifle innovation.
No
And I think
question.
also, yeah, absolutely. And where employers need to weigh in on these issues. And I think about the work that we can do in Maryland and Virginia and the District of Columbia to really make sure AI is regulated appropriately, that regulators don't go too far to stifle innovation, but at the same time, we ensure safety, confidentiality, all those things. Employers need a voice in working with regulators. So I know we are at the top of the hour. Again, I just want to thank the Consumer Technology Association for partnering with us on this very important discussion. We will have more of these discussions, both webinars and in-person meetings, where we focus on the effective use of AI. How do we harness the opportunities of AI while also protecting confidentiality, addressing health disparities, doing all those kind of things. This is not a one and done. We will have more discussions and more opportunities for employers to engage and share best practices, ask these kind of questions. And I know we're at the top of the hour. Any final comments from Renee or Carrie as we wrap up?
I'll start and turn it over to Carrie. I'll just say this should be the start of a collaborative opportunity between our sectors, and I'm looking forward to it.
Yeah, echo that sentiment as well. We look forward to continued conversations, and please consider us a resource as questions arise.
We would like to thank our moderator, David Johnson, and our panelists, Carrie Hairsign and Renee Quashie. Just a reminder that today's webinar has been recorded and will be available through our YouTube channel. Thank you for joining us today, and we look forward to seeing you again at future webinars.